Okay. So for today's class, we'll do a quick introduction about medical image computing. So basically, we'll talk about the different modalities of medical imaging. So what is medical imaging, right? So medical imaging is used to produce images of organs and tissues within the body for use in diagnosis and treatment. Okay. And there are different types of medical imaging can be used, and they can use to see different things within the body. And why is medical imaging important? So medical imaging allows doctors to find disease in their early stage, which leads to better outcomes for patients, right? So we can do the diagnosis. And it can also assist in decisions regarding the treatment and the future care of the issue. So radiology is a branch of medicine that uses imaging technology to diagnose and treat diseases. Okay, so there's for some of the universities, they have Department of Radiology, right? So they can train radiologists in the hospital. So here is a question for you. So I'm sure some of you guys more or less have know some of the imaging modalities, or maybe you personally have taking some of the medical imaging exams. So what a medical imaging modality do you know? So yeah, all these are very common and popular imaging modalities, right? So here, so all these, you've just kind of basically cover all these common modalities, right? X-ray, so using the electromagnetic radiation, and CT, is short for computer tomography. So you may also, heard of CAT, right? CAT, which is basically the same thing, computer axial tomography. So it's also using electromagnetic radiation. So basically CT, you can consider X-ray plus plus, right? So X-ray is doing a single scan to the image. CT is a 3D volume, right? You have multiple scans of the body. Also ultrasound that use the sound waves to do the imaging. And also MRI, magnetic resonance imaging, right? So that's using the magnetic. And also we have nuclear imaging, right? So, including PET, as PET. So they are using the nuclear radiation to get the image. So no matter kind of imaging system, so this is kind of the general kind of mechanism of any imaging system, right? So first of all, you have to have an energy source, right? Emit some of the energy, right? Like ionizing radiation, right? From X-ray. And these radiation will, go through or pass through the body, where some parts will be absorbed by different, tissues of your body, right? And some may be passed through. And there's an energy detection, component, right? Detect those remaining, energies pass through the body. And while using this detect energy to using some of the computer programs or algorithms to do the visualization or imaging. So you can see what's going on, right, with the different body parts. So there's many requirements for the medical imaging systems, right? First of all, you have to have some diagnostic contrast, right? Basically, so you have the pixel intensity in the image has to have, different contrast. You're able to identify maybe different tissues, right, organs, etc., right? It also has to be sensitive, right? You're able to, detect or show some of the disease on these images, so that can do some diagnosis. And also has to have some specificity, right? You're not just showing some of the disease, but the doctor is able to, like, based on some of the characteristics, able to tell, right, what type of disease that is, okay? And also oftentimes needs function, right? So we have anatomy and a function, right? So for this medical imaging, right, anatomy is showing the structure, of the body, and the function is, basically shows some of the functions like metabolism, right? And of course, high spatial resolution and also high temporal resolution. And also the medical imaging system has to be safe, right? So we are doing the imaging examination to help diagnosis or doing some of the treatment. We don't want this imaging system will damage the human body, right? So it has to be safe, and also has to be fast. You don't want to spend like hour or 2 hours in that room with the imaging system, right? So we want to quickly get in and take a quick scan and get out, right? It's has to be very fast, and also inexpensive, right? So if costs a lot to do some of the image exam, then maybe not a lot of patients can afford, right? If it costs a lot, so it has to be very cheap and cost effective, and also easy to use, right? So maybe you don't have to spend too much time and effort to train the radiologist or maybe operators to use these medical imaging system, right? So it can be easily just do some click, easily set up some of the parameters, and it can function as it desired. Okay. Obviously, there's probably no single medical imaging modality can satisfy all these requirements, and oftentimes several of the medical imaging modality have to be used together, right, to make the diagnosis. Maybe using CT plus MRI, or maybe CT plus PET scan to make the diagnosis. Okay. And here we want to show like how the engineering advances is able to kind of prepare this medical imaging domain, right? So this is the on this figure shows on the left shows the first X-ray in the 1895, right? So you can definitely see some of the internal of the human body, right? So this is the bones, and maybe this is some of the object like the ring. And today X-ray is much clear, right? Have a high resolution, is able to show all these details very clearly. And also CT is the same, right? In the early CT scan in 1975, right? So we can see some of the tissues of this human brain, right? The white matter, etc., the fat layer, some of the fluid. But you can see this is very low resolution, right? You pretty much cannot tell some of the specific parts, right? But for today, this is much clearer, right? So we can see the details of this CT image. So this is the ultrasound image, right? So in the early ultrasound image, so we are able to, tell some of the parts, right? Maybe this is the, maybe some of the water component, or maybe this is some soft tissue, right? So, but, there's not much of the contrast, right? So basically just maybe black and white. But nowadays we have very clear ultrasound images or even videos, right? We can to do the examination, right? Maybe in the the baby's feeders, right? To see how the is developed, right? And also for MRI, right? So in the early MRI, 1978. For this example, you are not able to tell a lot from this low resolution image. But today, so we are able to, have very good resolution for some of the soft tissues. So yeah, we'll talk more on these, different imaging modalities later. Okay. So basically, all these different image modalities can be captured by their electromagnetic spectrum, right? So here is the EM spectrum, So basically it's the range of all types of EM radiation, right? So here are some of the, typical, wavelengths, right? Corresponding to, first radio waves to the shortest one, the gamma rays, right? So the radio waves has a long wavelength that could maybe a couple of meters, 100 meters, can easily span like a football field, okay? And the shorter one, after the radio waves, the microwaves, right? So we are using microwaves at home, right, to heat up the food. And we also have, if we're going shorter wavelength range here, we have the infrared light, right? And then go to the, the visible light spectrum, right? So with the red with 700 nanometers, that's the longest, and with the shortest 400 nanometers for the violet, right? And if we're going the even shorter wavelength, right, and we have the ultraviolet light, so come from the sun, right? So if you expose too much time at the ultraviolet light, then you have the risk of sunburn, or you increase the risk of skin cancer, right? And if we go even shorter, wavelengths, right? We have higher frequency of the wave. We have X-rays, right? So it's able to examine the internal structure of the human body, and we have the shortest wavelengths here is the corresponding to the gamma rays, right? So it arising from the radioactive decay of the atomic nuclei. Okay, so basically we have, if the longer wavelengths, then we have lower frequency, that means lower energy, right? If we have shorter wavelengths, they have higher frequency and has higher energy, right? So we all feel that, right? If you have exposed to ultraviolet sunlight, we got extreme heat, right? The sunburn. Okay.